Thank you very much, Candace. Now, a Chester County High School student helping spread the word about a revolutionary treatment that helps patients recover from all kinds of brain injuries.
This is very, very interesting. The secret weapon, something we encounter every single day. The fact it's something that we actually need to live with.
That's right.
I mean, we have to use it.
It's oxygen. Student Darby Miskelly is here with Dr. Roy Schmidt from the Tennessee Hyperbaric Center in Jackson, Tennessee. Thank you so much. Darby, let's start with you. You are a basketball player, you are a soccer player, all-around good athlete, but you've had 2 concussions so far, and you're what, a sophomore?
I'm a junior.
You're a junior. So that's obviously concerning because from an athletic standpoint, one more concussion and the NCAA says you can't play, right?
Correct.
But more importantly, how did it affect your life, that second concussion?
In my schoolwork, it affected my schoolwork greatly. I had to have lots of help from my friends and teachers, and it took a while for the teachers to understand because on the outside, there's not a sign that I'm having problems. It's all on the inside.
Right.
And what are some of the symptoms? And when you suffer a concussion, what normally takes place when you're an elite athlete and you're in great shape and you eat well, but what are some of the symptoms that you're going to notice right off the bat?
Well, some of the first things you notice, some people get headaches. It's a very common thing. Not able to concentrate. Noises become a problem.
Okay.
So you're affected by people around you with noises and TV and all these things.
So focus issues.
Focus for Darby was a major issue.
So what is hyperbaric treatment and how does it play into, because you now are, I don't know, fully recovered, but you have seen your grades go back up, you have seen your focus come back. Tell us what the treatment is, Doctor.
The treatment is a very specific pressure that we increase the pressure of the atmosphere, and by increasing the pressure with 100% oxygen, you can push the oxygen to areas in the brain in this particular circumstance that are not getting enough oxygen. And
so it's like hyperoxygenated?
Well, yes,
air?
yes.
Okay.
So you increase your oxygen in your cell by about 300 times.
Now, is it different types of oxygen that you can use? Are there even options that give you a better effect? I know that might sound crazy, but is it like a different, like a particular 100% medical grade oxygen that you're pumping into the brain?
You want to use 100% medical grade because number one is clean, is pure, and if you're going to go through the trouble of doing it, might as well, you know, the oxygen is not the expensive part, so you might as well use the best quality you can.
So how many treatments, how many times a week? Is it something you do daily, and how long did it take you, Darby, to see an improvement? Let's start with you, Doctor, on the typical protocol.
Treatment for concussions and head injuries is 40 treatments. Each treatment is an hour and a half.
Okay.
And we like to start at 1.5 atmosphere. Now that gets changed a little bit according to how the patient responds. We don't go high pressures. We call this the low pressure therapy because the brain is very sensitive, and so if too much oxygen can actually do damage.
Okay.
So that's why we do 1.5 atmosphere to 1.7.
How quickly did you see a difference? Did you feel differently after the first couple of sessions or no?
It took me a couple of weeks for the headaches to go down, and it took a little while longer for the concentration to come back.
Wow.
And this is also helping combat veterans in addition to athletes as well.
Correct.
Is that true?
Obviously, we're seeing a lot of traumatic brain injury, post-traumatic stress disorders. This is being used quite successful for this treatment. Dr. Paul Harsh, LSU, is actually doing a study, a large study, to try to convince the powers that be, the people, that this is actually an option besides what we've been doing so far.
Well, I think if all they have to do is come to Jackson next Tuesday, you're going to speak at a seminar, basically telling your story, and all the information online about where you need to go if you have anyone in your life who has suffered a brain injury of any type. Thank you so much for sharing your story. Great work, Doctor. It's really exciting what's going on in Jackson.